Good day, everyone. So today I will be presenting to you a case report on esophageal granulomas in a dog infected with Spirocerca lupi. So let's get started. So here is the signalment. A 13-year-old neutered female Labrador Retriever weighing 26.4 kilograms was referred to the Animal Medical Center at Nihon University for evaluation of a thoracic mass and intermittent regurgitation. So itong pasyente was in good general condition pero nagre-regurgitate siya twice or thrice each month. And as for its history, ipinanganak siya sa Tokyo at the time of presentation. Pero meron siyang yung pasyente had previously lived in India a year before and sa UAE 4 years before. And as for its diet, the dog was generally fed dry food. So let's go for on the diagnosis. So nag-undergo siya ng mga laboratory tests. Una narito is yung CRP or yung C-reactive protein. Itong CRP, it checks for the inflammation of the body. So sa kanilang initial visit, a blood test revealed high C-reactive protein na may result na 6.2 milligrams per deciliter. Mataas din yung fibrinogen level niya na merong 750 milligrams per deciliter. However, all other parameters were within the normal range. Furthermore, no significant abnormalities were observed on general fecal examination via direct and flotation method. Meron ding mga diagnostics na ginawa. Una narito is yung ultrasound. No significant abnormalities din sa kanyang abdominal ultrasonography. And as for the radiograph, as you can see in the picture, it revealed a shadow mass in the caudal esophagus and a moderate amount of air on the cranial portion of the mass. Yan yung unfilled arrow. Ito. And ito namang filled arrow, ito yung soft tissue mass. Nag-undergo din siya ng mga CT scan or yung computed tomography. It revealed dilatation of the esophageal lumen of the cranial esophagus and more than four masses of varying sizes in the caudal esophagus. Itong unfilled arrows. Ito yung mga nodules or yung mga form masses. The largest mass was 24 millimeters wide and showed central mineralization without any enhancement by a contrast agent. And for itong white filled arrow, Spirocerca lupi associated mass shows central mineralization. So, itong meron siyang mineralization. Ito, yung may puti-puti. Without any enhancement by a contrast agent. And there is an invasion of the air-filled esophagus. And additionally, abdominal aortic mineralization was observed between the kidney and the liver. Ito siya. Showing the aorta shows advanced mineralization of its lateral wall. So, makikita nyo sa picture mayroong puti-puti beneath the vertebrae. Yan. Yan yung advanced mineralization. Nag-undergo din siya ng endoscope. So on the endoscope examination, it revealed a dilatation of the cranial esophagus and several smooth rounded nodules in the caudal esophagus. Yeah. So makikita nyo sa picture yung mga nakaturo sa unfilled arrows. Additionally, the nodules were also observed at the esophageal cardiac junction pero hindi siya gaanong kalaki to obliterate the opening. So, yan, maliit lang siya. Meron din ginawang endoscopic ultrasonography na nag-reveal siya ng pathological lesions were limited lang dun sa muscle layer or sa mucosa and were not found to infiltrate the mucosa pero hindi na pinakita. And two worms were found in the surface of the nodules. Yun, yung nasa field arrows. Yun, yung worms. The worms, one male and one female which appeared coiled ay natanggal using endoscopic biopsy forceps. And the male worm was slightly red in the second picture, and it measured approximately 6.16 centimeters in size. And the female worm was bright red to nasa left and measured approximately 10.2 centimeters in size. Nag-undergo din siya ng fecal examination. On this examination, using the formal ether concentration technique, it revealed the presence of eggs. Finally, the worms were identified as Sphaerocerca lupi. Nagbase sila sa morphological characteristics ng adult, parasites and the eggs, and their measurements and their habitats. So, nakita nila na-diagnose nila na Sphaerocerca lupi talaga yung egg na to. And meron ding biopsy na ginawa. The biopsy samples of the nodules were obtained by means of endoscopic biopsy forceps. And sa kanyang histopathological examination, it revealed esophageal granulomas with chronic inflammation of many plasmacytes and lymphocytes. Let's proceed to the treatment na ginawa. For the treatment of spherocercosis, the dog was administered with 0.5 milligrams per kilogram orally of milbemycin oxim on days 0, 7, and 28, and then monthly with a total of 6 times. And as for its post-treatment results, yung CRP level niya was decreased to 0.05 milligrams per deciliter 45 days after the initial administration of the treatment, which is the milbemycin oxim. Fecal examinations conducted using the MGML method 161 days after the therapy did not reveal eggs in the feces, and regurgitation also gradually resolved. So, effective yung treatment nila. Ito naman yung post-treatment result ng kanyang CT scan. Itong CT scan it performed 161 days after the initial administration. And it showed that the esophageal granulomas were remarkably reduced. So, lumiit na siya. However, no change was observed in the central mineralization of the granulomas. In addition, the abdominal aortic mineralization and dilation of the esophageal lumen showed no changes. So, laki din siya. And similar to the CT scan result niya, upper gastrointestinal endoscopic examination revealed a remarkable reduction in the granulomas. Ito sa second picture. Makikita nyo, lumiit na yung mga granulomas compared kanina. Medyo malaki-laki pa. Tapos yung nandito sa may itaas, wala na. Na-reduce na talaga. So let's proceed to the discussion and recommendation. Let's go first to the epidemiology of this disease. The majority of reports regarding this Sphaerocerca infection in dogs are from Israel, Greece, India, the southern United States, and South Africa. Meron ding mga reports sa Japan which have identified Sphaerocerca infection in 0.8% and 1.6% of autopsies performed in feral dogs collected from Kyoto and Shizuoka respectively. And furthermore, this infection has been also detected during the performance of an autopsy in dogs in Hyogo and Fukushima, respectively. And recently, epidemiological investigation in Japan have identified this infection in 1.9% of Japanese raccoons in the Chubu Mountain area. So how is this related to the case? The dog discussed in the present study ay pwedeng naka-ingest ng paratenic host or coprophagic beetles in the foreign countries where it had recently lived. So alternatively, the dog could have also contracted the infection in Japan since Spirocerca lupi can reach the esophageal wall from the larval ingestion stage in approximately 100 days. However, when and how the dog was infected remains unknown, according to this report. Since veterinarians are less aware of this infection in Japan, attention must be paid to animals imported from countries or companion animals that had lived in epidemic area. So napaka-importante talaga ang quarantine pagdating sa pagpasok ng mga hayop sa kahit anong bansa. As for its diagnosis, this infection, these Spirocerca eggs can be difficult to identify by direct flotation methods of fecal examinations. In the present study, the eggs could not be identified using general fecal methods. However, the Spirocerca eggs were identified using the MGML method, which is hindi siya yung standard stool examination test na ginagamit sa clinical practice. This method should be aggressively applied in cases of esophageal masses at veterinary hospitals. A previous study reported no evidence of subsequent shedding of the eggs in feces from 31 to 130 days, 33 days after the commencement of milbemycin oxim treatment. And fecal examinations using the MJL method were not performed for a long period, uh, just like the standard na 161 days after the therapy. It is therefore possible that the eggs had disappeared earlier than 161 days after the initiation of the treatments. In the majority of dogs infected with this Spirocerca, radiography often reveals a mass in the caudal esophagus in addition to the presence of air crenulatodemas. Similar sa radiographic finding ng case na ito, ganito din yung na-reveal. It has a mass in the caudal esophagus in addition to the presence of air. Ganun din sa kanyang CT exam. CT exam is also a useful tool for the diagnosis of canine spirocercosis, and it is used for evaluating the extent of the lesion, identifying the pleural, mediastinal, and pulmonary pathology, and assessing aortic mineralization, aortic aneurysm, and small pulmonary nodules. And sa case na ito, yung CT scan revealed aortic mineralization and the extent of lesion. So, napakalaking tulong ng diagnosis na CT scan. As for the endoscopy, ay mas sensitive kaysa radiography in the diagnosis of this Spirocerca infection, which may have only progressed to a small nodule in the esophagus. A previous study showed 100% sensitivity of the endoscopy and 80% sensitivity of fecal flotation and 53% sensitivity of radiography in the diagnosis of esophageal mass. Sa case na ito, it also demonstrated that the endoscopy is useful for the diagnosis of this infection. Early infection typically presents with one or several smooth rounded nodules. However, over time, the nodules may enlarge and become rough, ulcerated, lobulated, and cauliflower-like masses because the nodules found in this case were smooth and rounded. So the Spherocerca infection in this dog might have been in its early stages. As for its treatment, several drugs have been used for the treatment of spirocercosis. And recently, the efficacy of the doramectin has been reported. However, the drug has to be injected into the patient, which is inconvenient. But additionally, the drug is prohibited in collies and related breeds because of its toxicity related to the multi-drug resistant protein gene mutation. For the melbimicin oxime, it is orally administered, relatively inexpensive and efficacious against the larval forms situated in or migrating from the aorta. Therefore, milbemycin oxime was administered using the protocol in this case. And the treatment was successful and nakita nyo naman sa mga post-treatment results niya. It was successful against almost all granulomas in this case. However, the central mineralization in the mass and the abdominal aorta remain. So nanatili siya. Moreover, few esophageal granulomas hadn't completely disappeared. But at least na-lessen niya yung mga granulomas. The existence of the parasites in the nodules or aorta lesions could not be determined. Furthermore, it is important to note that the esophageal granuloma caused by this infection may be translated into sarcomas. So, it is recommended that further follow-up studies ay kailangan to determine the completion of the therapy of these Spiroserica lupi infections. So that would be all. Thank you.